Okay, everyone, it doesn't matter who you are, I would love you to stop for 3 minutes and just listen to what we have to say, because what I'm about to tell you could potentially save the life of someone that you love. Now, I want to talk about breast cancer, in particular, people with dense breasts. I have very dense breasts, in fact, more dense than they were 2 years ago. I also have a family history of breast cancer with my mum and my auntie both having had breast cancer. There is a brand new technology which is very exciting that's come from interstate with Benson's to here in South Australia specifically to help people with dense breasts. I have just done this very special mammogram and it was mind-blowing and I can't wait to share it with you. I've teed up the incredible Dr. Shan to answer all the questions we have that could potentially save your life. Okay, this is very exciting. I'm going to ask you, the amazing Dr. Shan, all the things that we all want to know about this new mammogram. Let's start from the very beginning. Tell us a little bit about it.
So contrast enhanced mammography essentially is like a normal mammogram, but we inject X-ray contrast dye into your arm prior to doing the standard mammographic images.
And how does that change things up?
Breast cancer, very similar to other cancers, rely on abnormal blood supply to grow. And so by injecting the X-ray dye prior to the mammogram, this highlights those abnormal vessels and makes these cancers stand out from the normal background tissue.
Okay, so I can say this because I have extremely dense breasts and I know that my mammograms, my normal mammograms, have always looked just white, and that's because it's showing everything. Then I had this one and all of a sudden that all goes and it will only show if there is something to worry about.
That's correct. So breast density is not how your breasts look or feel. It's a mammographic assessment. So your breasts, when we look at them on mammogram, are extremely dense because you've got a lot of fibroglandular tissue. And that's important for 2 reasons. Firstly, small cancers can be really hard to detect with all that other tissue in the background. And secondly, women with very dense breasts have an increased risk of developing breast cancers.
I'm using me as an example and hopefully this resonates with a lot of other people watching this. I used to always get mammograms because of my history, but then I was told, well, it actually doesn't show much because it is all white, so then I was getting MRIs. So with this new technology, should we be mixing it up and doing an MRI one year and then one of your special mammograms the next year? How should it work?
Well, every client is going to be different, and I think it's really important to firstly speak to your doctor, and to look at other risk factors beyond breast density. Because some women have an incredibly unpleasant family history. They may have a genetic predisposition to breast cancer, and those women are probably the subset that should be having MRI. But then there are those other ladies, such as yourself, who may just have dense breasts and not much else in the way of family history.
I gotta say, I was blown away. I literally was. did not know what I was gonna see, and having seen my mammograms before and seeing them all white, and then seeing after the blue dye had gone in and your results from this new mammogram is unbelievable. And I will not go back to the other way because now I feel like if there is something, you're gonna pick it up.
Well, that's great. I mean, that's what we're offering this for, because MRI is not only difficult to get an appointment in, but also it's uncomfortable.
Yeah.
The examination tends to be longer, and obviously there's a more significant cost associated with it.
So with Benson Radiology, you've brought this to South Australia. Why is it so important to you?
Well, Hayley, the contrast enhanced mammography has been around probably for more than a decade, particularly internationally. The eastern states have been offering it to their women for years, and we felt as leaders in breast imaging, this was an opportunity for us to introduce something to the women of South Australia that could have a benefit in early detection.
Thank you for all that you've done, and I'm so impressed, and I just want to get this word out there so that everyone, not just women, I want husbands and boyfriends and sons and everybody to get onto the women in their lives and get them checked.
Thank you so much, and look, thank you to you too for taking that, seeing an opportunity and giving it a go yourself and finding out that actually it's not as scary as what it sounds.
No, and even if it was scary, it's so worth it.